Hello, everyone. I've been getting a lot of questions about caffeine and whether it can help performance. So let's break it down quickly, based on what the research actually says. So, benefits of caffeine use. Caffeine is one of the most well researched ergogenic acids out there. Studies consistently show it can improve alertness and reaction time, reduce the perception of fatigue, enhance endurance by increasing fat oxidation, which is inherently sparing to glycogen, and provide small but meaningful boosts in strength, sprint performance, and jump height. For basketball players, that means better focus late in the game, quicker decision making, and possibly a little extra in those repeated sprints up and down the court. However, caffeine does have some disadvantages. Caffeine isn't magic, it does have downsides. Too much can cause jitters, increased heart rate, anxiety, trouble sleeping, and even an upset stomach. Poor sleep is one of the biggest potential pitfalls here, because if you're not recovering, your performance is going to suffer, on and off the court or field. Some athletes are also more sensitive than others, so individual tolerance matters and it's specific to each individual athlete. So, athletes who may benefit. Endurance athletes like distance runners, cyclists, and swimmers tend to get the biggest boost from caffeine because of its effect on fatigue and glycogen sparing. But court and field sport athletes like basketball players can also benefit, again, as we discussed, mainly with their reaction time, quick bursts, and mental sharpness. NCAA guidelines. It's important. Caffeine is not a banned substance by the NCAA, but there is a threshold. If an athlete tests with urinary caffeine concentrations above 15 micrograms per milliliter, it can be considered a positive drug test. So to put that into perspective for you, that's probably around 5 to 6 strong cups of coffee or a couple lattes, depending on what you're getting. Obviously, caffeine pills would be able to tell much easier because there's a milligram dose on the pill and bottle, but that's in a short period, so probably 2 hours or less. Recommendations for you. So, based on current research, effective doses are about 3 to 6 milligrams per kilogram of body weight, taken about an hour before competition. So, for a 180-pound athlete, that's roughly 250 to 500 milligrams. So, that's again about 2 to 4 strong cups of coffee, probably closer to 4. More is not better. You have to stay within that range. We're not going to test positive. We definitely can't afford to do that. We have to test it in practice first. Never experiment on game day because getting the jitters or any heart palpitations could not only ruin your performance but could be potentially dangerous. The bottom line is we have to use it smartly, keep it in moderation, time it well, and we don't let it interfere with our sleep or recovery. And that's the best way to utilize caffeine. So if you're thinking about using it as a tool, not a crutch, talk with me or training staff before you try it so we can dial in what works for you, your dose, and make sure you do it safely. Thank you.